Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
We're developing vaccines not only for infectious diseases, but we're developing vaccines for oncology, cancer, Alzheimer's, Parkinson's disease, HIV/AIDS. So if we are going to be so hesitant about vaccines, we're not going to be able to defeat some of these long-term chronic illnesses that affect people.
Welcome to the Healthcare Matters podcast, a podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. He's Dr. Robert Popovian, joining us from Los Angeles, California, a pharmacist, economist, and chief science policy officer at GHLF.
And he's Connor Mertens, up the coast from me in Seattle, Washington. He's the Patient Advocate Community Outreach Manager at Global Healthy Living Foundation.
Thanks for joining us. As you know, our purpose, the big reason we're here and have a podcast, is to help simplify the complexities in our healthcare economics and policy issues that affect you and the patients and everyone around you. Robert's the expert. In fact, he's one of the few people who has studied and published both clinical and policy-related economic analysis. So you know he knows what he's talking about.
And you know what? Connor brings it down to the human level, as he helps people with chronic disease be more understood by loved ones and policymakers.
Now that you know who we are and why we're here, we're going to dive straight into today's topic. Robert, something that's so topical and so important for us to talk about are the COVID-19 vaccines. It seems like everyone's talking about it. Not enough people are getting it. I think it's such an important and interesting topic because every time we get a vaccine, it seems life expectancy goes up. They've been mandated in the military and schools for generations. We'll get to mandates later, but we've seen many diseases come and go, polio, measles, et cetera, And while COVID vaccine is, in air quotes, new technology, it isn't. Robert, tell us why we should take the COVID vaccine and why we should trust it.
Well, first of all, it's a miracle that the biopharmaceutical industry was able to get this medicine out as quickly as possibly that they could. And they had the attention of the policymakers, the Food and Drug Administration, to be able to do this. This was not a singular effort by just the biopharmaceutical industry. It takes a village to get the product out. And it's a critical vaccine because it is hopefully going to get us out of the pandemic and going back to normal life as we knew it before the COVID-19 pandemic hit us. So it is critical for everybody to take it because one of the things that people forget is that COVID-19, just like flu and other infectious diseases, are communicable diseases. So we all have to be vaccinated. The ones that we can are obviously individuals that cannot because of the immunity issues that they may have and so on and so forth. But all of us that are capable of taking the vaccine, we need to get it. So then hence we can develop the herd immunity that protects all of us, and especially the vulnerable patients, which are the elderly and the younger patients or people who are immunocompromised.
So what do you say to the people who are concerned that this was developed so quickly? This technology has been around for a while. Can you tell us a little bit more about that?
That's true, Connor. mRNA technology is nothing new. Scientists have been working on this technology for a long time in a variety of different therapeutic areas, including cancer therapy. It's just that the application for treatment as utilized as a vaccine for infectious diseases was not the one that they were looking into. So the technology, the baseline technology of mRNA has been around. We were able to basically utilize that platform to then develop the COVID-19 vaccine. So although it was done expeditiously, unbelievably fast, again, the baseline understanding of the technology and the scientific understanding of how it will work in the human body has been being studied for decades. And in fact, when the COVID-19 vaccine was authorized by the Food and Drug Administration late last year, my comments publicly were more like, this is a justification of the platform itself rather than the vaccine on its own. We're going to be able to use this mRNA technology platform for future diseases in infections and other type of diseases. And in fact, multiple companies are now working on vaccines using this type of platform. The good news is we have a new way of developing medicines for both infectious disease vaccines and also vaccines related to chronic diseases or oncology and so on and so forth So it's nothing new that we were looking at, but this was the breakthrough we needed to justify the platform itself.
Absolutely. I think it's a very important distinction that we have to make between folks that are vaccine hesitant and those that are pure anti-vaxxers. Being skeptical of a health system that has done harm in the past is fair. And like we were saying, the onus should be on the medical community to bridge those gaps. But that's very different than someone who thinks a vaccine has a microchip in it. The problem's the same, but the motivations are completely different. How do we reach these communities where they're at?
You're absolutely right. So first of all, let's step back. What the COVID vaccine and these new vaccines have done is that they've revealed once again that there is a significant vaccine hesitancy and resistance among Americans, as you've said. And there are two different issues. There's the anti-vaxxers that have traditionally been anti-vaccination to start with, that we need to be able to somehow corral and educate and make them understand that the benefits of the vaccines brings to society. And then there are individuals that are truly hesitant about vaccination, whether it has to do because of past experiences that they've had through vaccination in different patient populations, or because they're just skeptical because, remember, this is a new science and they need to be educated as well. So we need to distinguish those two entities and be able to educate them and bring them along to make them understand the value of immunizations and herd immunity and so on and so forth. And all of us will benefit if they come along with us. Now, having said that, politicizing the vaccine issue, like it has been done in the past, is the biggest mistake that we've made. Because the more we politicize, whether we politicize on the right or on the left, we make things worse. And these people do not want to be politicized. They want to be heard, and they want to have a legitimate conversation. And the best people, Connor, and you know this because you work with patients every day, are the healthcare professionals. They're the most trusted entity. These people don't want to hear it from a government official or from an institution or some agency that is faceless and nameless. They want to hear it from their own healthcare professionals. So it is the opportunity that healthcare professionals, whether it's a physician, a pharmacist, a nurse, that we need to step forward and take on this mandate and really get engaged and help patients understand and make sure that it no longer gets politicized as it has in the last few months.
I think you're absolutely right. The way that things have been politicized has really been a detriment to public health. Science doesn't care what letter is next to your name when you're voting in a booth. I'm curious, Robert, how does the reaction to the COVID vaccine compare historically to other vaccines? Again, we mentioned polio earlier. I think that was reveled when it was discovered and widely celebrated. Did we see same outrage and up in arms fighting for past vaccines?
No, we haven't. But there's been a building institutional sort of hesitancy and resistance to vaccines built over time in the last few decades. Part of it has to do because there's been some bad experiences by certain communities, and specifically communities of color in the United States, about vaccines and the vaccine research issue. So they have legitimate concerns and that need to be addressed. The other thing has to do with that there's so much more social media today and misinformation that you see out there about vaccines in general. And I allude to the fact that one of the main issues that was brought up for vaccine resistance or anti-vaxxers use is the safety concern. And all of those safety concerns that came up about 10, 20, 25 years ago have been put to bed and scientifically been found to be nonsense. Unfortunately, what has happened is that you still continue to see the same rhetoric come up over and over again. Again, I have to go back to the issue that we as healthcare professionals, and I consider myself one as being a pharmacist, we need to work with individuals that you represent, Connor, who are the patients, and really help them understand that this is the best way for us to step forward.
I think it's a very important point. And we are the most informed generation. We have every answer we could ever imagine at our fingertips, and yet we're here. We're at this point. What are the long-term consequences, Robert, that you can see associated with these misinformation and what we're seeing now?
And this is why Dr. Matthews and I wrote this op-ed on The Hill, is that the vaccines are the future of healthcare. We're developing vaccines not only for infectious diseases, but we're developing vaccines for oncology, cancer. We're developing vaccines for Alzheimer's. We're developing vaccines for Parkinson's disease, HIV/AIDS. So if we are going to be so hesitant about vaccines, we're not going to be able to defeat some of these long-term chronic illnesses that affect people. Look, as a medical community, we've done a good job. We've emphasized, prevention with regards to exercise and lifestyle changes, but no amount of exercise and lifestyle change is going to prevent us from getting a tetanus or chickenpox or COVID or polio or shingles. We need to have these medicines. And we are developing future medicines based on the platforms that we discussed with, whether it's the mRNA platform or just vaccines in general. If we don't get this right, not only there are consequences about us not being able to get out of this pandemic currently, we're going to suffer as a society long term because we're not going to be able to then get the benefit of these newer therapies that are being developed in different disease areas, not just infectious diseases.
Well, Robert, as you know, we like to talk policy, and I know this is a tough question, but when does it become necessity that we implement mandates? Is that the right answer here? What can we do to curb this and keep it from coming back?
We have mandates right now in this country for immunization for children. If you want to attend school, public school, but most private schools go along with it too, because both of my daughters went to private school when they were younger, and they both had to have all their vaccines done. We do have mandates. So it's nothing new that we're trying to say, oh, well, mandates have never worked or mandates don't exist. That is not true. We do have mandates in vaccines. Now, we've sort of skirted the issue on the adult population. And the interesting part is that we don't have a good knowledge base about the data. For example, flu vaccine, which is something that's recommended for all the way through from the age of 6 months to senior patients. We sort of poo-pooed it, and a lot of individuals under the age of 65 don't get the flu vaccine. Yet, the year before the pandemic occurred, we had over 60,000 deaths just from flu. So imagine if you had taken the flu vaccine, and imagine all the excuses about how the flu vaccine is not as effective. Let's say the flu vaccine is only 30% effective, right? And you had 60,000 deaths. You would have prevented 18,000 deaths that year. That's how we need to think about adult vaccination. We need to have some parameters without first and educating them and saying, okay, we get it. Not every vaccine is effective, because that's what you hear a lot externally. But just in case of flu, which we know it's not the most efficacious vaccine, it would have possibly prevented 18,000 deaths in the United States. In my opinion, we have had mandates. We have mandates for pediatric patients. Whether or not we should have mandates in the adult population, I think it's first, let's get through the education and make sure that people understand and put it in context of what it will happen to you if you don't have one. And then let's get into a discussion about how do you make sure that the most vulnerable patients in this country are not exposed to infections. And that's the only way for all of us to get immunized and for us to have herd immunity.
As you mentioned, we're on the cusp of some major breakthroughs because of the technology that has been cultivated during this COVID-19 pandemic and the subsequent rush to find a vaccine. The entire world scientific community focused on this technology, and there's so much to look forward to. And it really is heartbreaking when the misinformation is spread and folks lose their lives because of it. What's your last word? What are we going to tell folks to take away from this episode?
Look, what I'm going to tell folks is that talk to your healthcare professional, talk to your pharmacist. They're the most accessible one, right? You can walk into any pharmacy without an appointment and talk to a pharmacist about immunization. Make sure you have all the facts from a healthcare professional, not from Twitter, not from Facebook, not from Snapchat, TikTok videos. They should be listening to their healthcare professionals. Also, organizations like Global Healthy Living Foundation that get their information from healthcare professionals. Don't just say no without having all of the answers to your questions. The second thing I would say is that future vaccines may be our best preventive medicine option for long-feared diseases. They may even become the preferred treatment option. Let's hope that we won't be politicizing vaccines in general, like what we've done with the COVID-19 vaccine, because that will be the detriment to all of us long-term as a society. And remember, one last thing. The least effective vaccine is the one a person refuses to take. We don't take the vaccine, we don't get the benefit. We don't get the benefit, we suffer from it. Thank you for listening. We'd love to hear from you about the COVID-19 vaccines in general. Send your emails to healthcarematters@ghlf.org, or better yet, including short video or an audio clip for us.
And who knows, whatever you say may be included in future listener feedback portions. Thanks for listening to Healthcare Matters, a podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. If you like this episode, give us a rating and write a review on Apple Podcasts. It'll help more people like you find us. He's Dr. Robert Popovian.
And he's Connor Mertens. See y'all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.